Okay, good evening, everyone. I am Israa Alameen, a senior radiology resident. I'm glad to be among you here today. Today, I'm going to talk to you about a case related to the pediatric imaging. So first, I'm going to start with the clinical history of the patient. An 8-year-old male patient who presented with left facial swelling of progressive course. This swelling was associated with pain and difficulty in mastication. Dynamic MRI neck with contrast and MRA study were requested, and the following MRI findings were noted. So, first, whenever we read any MRI study, we should ask ourselves, where is the pathology? Because it's very important at first to determine the origin of the pathology, because this can help us limit the differential diagnoses. So, as you can see here on the left, this is an axial T2 sequence. We can see that there is a soft tissue lesion involving the left masticator space, mainly the left masseter muscle. In image B, the axial T2 sequence, we can see also affection of the left medial pterygoid muscle. And image C on the right, this is a coronal T2 stereo sequence, which shows that there is transspatial lesion occupying the left masticator space, starting in the left masseter and passing through the mandibular notch to involve the left medial pterygoid muscle. So now we determine the origin of our lesion. Let's next see what is the radiological finding then. Here on the left, this is an axial T1 sequence in which we can see a soft tissue mass lesion involving the left medial pterygoid muscle and the left masseter muscle. This lesion has an outer labulated margin. It exhibits low signal intensity, as you can see in the T1 sequence. And in image B, we can see that this soft tissue mass lesion exhibits a high signal intensity. And finally, in image C on the right, this soft tissue mass lesion exhibits also high signal intensity. Here on the left, we can see an axial diffusion image in which we can see that this soft tissue mass lesion does not exhibit any high signal intensity in comparison to the ADC map on the right. So this denotes that there is no true diffusion restriction of this soft tissue mass lesion. Here, this is the sequential dynamic contrast study. On the left, in image A, this is the early arterial phase of the contrast study. And here, we can see no enhancement of this soft tissue lesion. In image B, the venous phase, we can see that there is gradual filling of the soft tissue lesion, which continues also in the delayed phase of the venous study, as you can see on the right. Here on the left, this is the axial T1 post-contrast image, and here we can see that there is patchy enhancement of this soft tissue lesion. And on the right, image B, this is the MRA study in which we can see no definite arterial feeder supplying this soft tissue lesion. So, let's in a nutshell sum up the MRI findings we have seen so far. We have seen a left masticator space soft tissue lesion within the left masseter muscle. It is a transspatial lesion extending through the mandibular notch to involve the medial pterygoid muscle. This lesion has an outer labulated margin exhibiting low signal intensity in the T1 sequences, high signal intensity in the T2 sequences with no definite diffusion restriction. We have seen in the dynamic contrast images that there was gradual slow filling in the venous and delayed phases with no arterial feeder in the MRA images. So, correlating this with the history of the patient of a facial swelling of progressive course, we can reach the diagnosis that this is a case of venous malformation. In order to be sure of our final diagnosis, we should be able to differentiate the other differential diagnoses. So, since the venous malformation is a vascular malformation, we should exclude the other vascular malformations. And since it was a soft tissue mass of muscular origin, we should be able to differentiate the soft tissue masses of other muscular origin, like the rhabdomyosarcoma. So let's quickly see the other vascular malformations to be able to differentiate them from each other. So here, this is a typical case of a hemangioma. In image A on the left, this is an axial T1 sequence. We can see a soft tissue mass lesion exhibiting low signal intensity with internal flow void vessels. And in image B, in the axial T2 star sequence, we can see that this soft tissue mass lesion exhibits high signal intensity with the internal flow voids. And in image C on the right, in the T1 post-contrast images, we can see that there is homogeneous enhancement of this soft tissue lesion, and definitely this enhancement will be in the early arterial phase of the contrast study. Next, this is another vascular malformation, which is the macrocystic lymphatic malformation. Here, in image D on the left, we can see a well-defined cystic lesion with fluid level inside, denoting intralesional hemorrhage. In the sagittal T2 sequence in image E, we can see multiloculated cystic spaces with fluid level inside. And in image F on the right, in the T1 post-contrast image, we can see marginal enhancement of those cystic spaces. And this is typical macrocystic lymphatic malformation, how will appear in the MRI images. Next, this is a case, another vascular malformation, the microcystic lymphatic malformation. In image A, the coronal T2 stair on the right, this is, on the left, this is a tubular rounded structures with high signal intensity inside, and in image B on the right, in the T1 post-contrast image, we can see no enhancement of those tubular rounded structures. Another case, and the last type of the vascular malformation, is the arteriovenous malformation. That's a high flow vascular malformation with no definite soft tissue mass lesion. So in image D on the left, in this axial T2 sequence, we can only see the signal void, the flow void vessels. And in the M2DI image, we can see the flow enhancement related to those vessels. And in the inverted MEP reconstruction on the right, we can see the vessels representing the arteriovenous malformation. And finally, we need to exclude the other last differential diagnosis, which is the rhabdomyosarcoma. Here, image A, we can see coronal T1 sequence, a soft tissue mass lesion originating in the right masticator space with obliteration of the fat planes as the arrow points. In image B, we can see that there is bulging of this lesion through the mandible, and this is a feature of malignancy as it invades the bone. Image C, we can see that in the axial T2 sequence, there is high signal intensity in this soft tissue mass lesion. And finally, in image D, we can see heterogeneous enhancement of this soft tissue mass lesion in the T1 coronal post-contrast images with areas of necrosis inside. And as the large arrow points, we can see invasion and spread of this lesion through the foramen ovale to involve the right cavernous sinus. So, how can we then differentiate it from the venous malformation? First of all, clinical examination. The venous malformation will be soft on palpable examination, unlike the rhabdomyosarcoma. It will be hard, since it's a malignant lesion. Second, the rhabdomyosarcoma will cause true diffusion restriction, unlike the venous malformation. And finally, the surrounding bone destruction and the perineural spread, as we have seen in image D. So, our take-home message. Venous malformations are benign vascular soft tissue tumors. They can arise in various anatomic locations, as we have seen our case striated muscle, skin, subcutaneous tissue, and synovial tissue. Vascular malformations are mainly a clinical diagnosis, so we should first start by ultrasound. If we are still in doubt, we will then proceed for a dynamic MRI contrast study and MRA to confirm our diagnosis and sometimes to determine the extension of the lesion. It's very important to be capable to differentiate between the different vascular malformations by MRI. Here, in this schedule, in a nutshell, I'm reminding you that the hemangioma will be a soft tissue mass lesion with the high flow signal void vessels inside, showing enhancement in the arterial phase of the contrast study. Remember that the arteriovenous malformation, there is no soft tissue mass. We'll just see serpiginous high flow vessels. The venous malformation, typical like our case, a lobulated mass with patchy enhancement, mainly in the venous phase of the contrast study. The macrocystic lymphatic malformation, it will be cystic spaces showing marginal enhancement in the contrast study. The microcystic lymphatic malformation will be rounded tubular structures showing minimal enhancement or not enhancement at all in the contrast study. If you want to have further reading about the vascular malformations, have a look at our poster in the ESR. And that was all regarding my part. Thank you so much.